All right, welcome back. Chapter 4, we have a little bit more color here, but in Chapter 4, we're going to start talking about a little bit about theory and theoretical framework. So bear with me. Sometimes this is a little abstract for individuals, so just you might have to listen to it a couple times. Make sure you're reading your book, as well as if there's any or there's always tons of or not, excuse me, not articles. Well, there are articles talking about theoretical frameworks, but there's also videos out there that you can link to as well. So, and not only are we talking about nursing theory levels, but we're also talking how a theoretical framework relates to research. So here are learning objectives for this content. So I think we talked about this a little bit in the first lecture, but these are just a couple different graphics that really display the relationship between theory, research, and practice. And as you can see that all three of these are connected to one another to create an extensive nursing knowledge base which promotes high quality patient care. And if you remember me saying that everything that we do in practice was related to research, but research, came from some sort of a theory generally. And all of these are interconnected and will help drive what we do in nursing. So let's think about this. So what if we practice medicine based on only two out of these three things? Maybe if we were just practicing based on theory alone. So let's look at an example of how that would affect the care of a patient during resuscitation. It was theorized that for artificial respiration, all we needed to do was move air in and out of the lungs as two methods of resuscitation were born. Bird's method of infant resuscitation and Sylvester's method for adults. So this was the practice behind this based on this theory. So Bird's method was to grab an infant by the legs in one hand and the head and back in the other. Then the nurse would double the child over by pressing the head and knees against the chest. Next, they would extend the knees to undouble the child, which was repeated through not too rapidly because that would be too over the top, right? So just think about that. If we're less, if we're trying to move air in and out like an accordion, right? That was the theory, and that was what was practiced for years. So for this Sylvester's model, the patient would be placed on their back. The nurse would grab the patient's elbows and adduct them to push in on the ribs to expel air. So they were going like this, right? Again, like this accordion effect. Then the arms would be slowly pulled over the chest so the chest would expand 18 to 20 times per minute. Though neither of these techniques works, they were considered best practice for like 40 years until autopsy showed that the patient's veins were engorged but the arteries were empty. So think about everything that we do in practice again. Now, you can think back and you can look at back in history, there was a lot of strange things that were going on in how we cared for patient. Now, right or wrong, that was the theory back then, and that's what had been quote unquote studied. But what was missing in all of this? Right, we missed the research component. So this is why research was started. It had to, you know, it had to quantify and clarify what we were doing in practice was actually benefiting the patient or, getting to these outcomes. So this is an example of why all these links are necessary for evidence-based, high-quality care for our patients. Again, research drives practice. Theory rides along with it, right? Because again, they're all interconnected, but we can't have one without the other. So here's another crazy example of missing the research step with corpse medicine. So during the 16th to 19th centuries in England, they believed that consuming different parts of a human corpse would cure different ailments. For instance, people would ground up pieces of the skull to cure nosebleeds and epilepsy. Just think about this. Then superficial wounds were wrapped in fat-soaked bandages. Blood was known as the elixir of life and was given to cure leprosy, as well as could be used to give the drinker strength and starve out or stave of illness. But again, think about that. I mean, that is in today's world, that doesn't even sound logical or even appropriate. Or, we don't carve people up and grind them up to do things. So again, this research component was totally missed. And obviously it's been a research and now we don't do those things. So, looking at those examples, it seems clear that research, theory, and practice are all linked. Though even now, theorists, researchers, and practicing nurses work in isolations from one another instead of together and in collaboration. So when you think about it, so from a theorist, they're focusing on an abstract concepts and their interrelationships. Really, that's what a theory is and what a theorist is focused on. Researchers are systematically collecting knowledge about samples and populations. And then practicing nurses are focusing on unique individuals. So you can see that these different components. And if you think about, remember when we were looking at that informatics slide, how it's building, from computer science and informatics and nursing practice. Well, this is doing the same thing. We're taking theories or theorist thoughts, researchers' thought, and what we do in clinical practice, and we're putting those all together. So actually, each bedside nurse does engage in research and theory on a patient level. Each patient could be considered a study with one subject where the nurse's assessment is considered the data collection. After analyzing the data points from assessment, the nurse could develop a plan of care. This plan of care is actually a theory, right? And what will work to help this patient, because it's all very individualized. Think about that. The theory is then tested by implementing these interventions, and if the patient gets better, then the theory is validated. If the patient has a negative outcome, the theory is refuted or questioned, and a new theory is recreated, resulting in a revised plan of care. Let's take a patient who is exhibiting hypotension, tachycardia, tachypnea, hypothermia, and leukocytosis. What could this patient's diagnosis be? Think about it. Think about your patient here. Well, septic shock could be one thing. So based on our analysis of our assessment data points, we came up with a theory of septic shock. What would we do to test this theory? What type of interventions would we have, right? We would maybe give fluids, antibiotics, antipyretic, blood cultures. What if you were not sure what to do for the patient? Well, you may talk with colleagues and the provider. Your collaboration is important for theory development, where we are all learn from one another. Can you kind of see how this all applies to you at the bedside? Because every day we're doing this. We're testing theory. We're testing what we knew and we're putting it to practice. Or we're disputing this because what we think we know and what should be happening maybe really isn't what is happening. So when we think about the concept of theory, the clear definition from your book is a set of interrelated concepts that provides a systematic view of a phenomenon. So why is this important to research? Why do you think that this is important? Well, it gives a researcher a logical way to collect data that explains nursing practice, and it allows this relationship to be proposed and predictions made. What this means is that nursing practice is based on theories that are generated and validated through the research practices. Since the purpose of research is to build a nursing knowledge base, this is accomplished through theory generation, then testing those concepts within the theory so that the information can be applied to science. So when you think about your PICO question and you're coming to some sort of a plan to be thinking about what your theorist is, right? You want to think about your independent variables and your dependent variable. What is your outcome? What are you trying to solve for? How can you take a theory that is known today, created by a theorist? It does not have to be a nursing theory by no means. And how does that apply to your question? Now, I will tell you that you can take any theory and maybe manipulation is a strong word, but you can make it fit your question. You just have to think outside of the box about that. So this is not sometimes just a simple process. You have to think about it. You have to think outside of your box of how does this theory and this theoretical framework apply to my question. So let's look at a few key terms for theoretical frameworks. A concept is a word or could be a short phrase that is an idea about some phenomenon that is usually a generalization about some particular thing, such as concepts of psychology, right? Concepts can be abstract or they can be concrete. Abstract concretes are difficult to quantify or measure, such as hope. So if you're measuring, if you're measuring hope, and that's as considered a concept, then you have to have some sort of a tool and instrument that actually is defined and operationalized by the researcher, but it has to be very quantifiable. So, maybe that's in a Likert scale or something like that. It also could be an image or a symbolic representation of a phenomenon or aspect of reality. It can be words or phrases that convey a unique ideal relevant to a theory, so such as hope, that again, the researcher would have to define what hope means for the purposes of research. And again, it could be this generalization about something in particular. When we think about a construct is more complex and is usually more than one concepts that are linked together. Constructs are usually not able to be directly observed, such as social support. This cannot be directly observed, but can be inferred through assessment of other things like talking with a patient about their family and friends or their perception of support. So again, constructs are generally more than one concept that are linked together. It could be a phrase or a word, and what it could be doing is linking those together. So if you think about some other examples, they could be help promotion, they could be quality of life, they could be maternal infant bonding. I mean, if you can go on and on. So see how that is different than just a clear concept. A conceptual definition, there are two types of definitions for a concept, the conceptual and the operational definitions. The conceptual one is like what you would see in the dictionary. So this should be a similar from study to study. Okay, so it's the true definition of whatever that concept is or whatever that word is. And it conveys the meaning of the concept as rooted in the theoretical literature. The operational definition defines how that specific concepts, again, these are often called your variable, is going to be measured. Operational definitions can vary from study to study because there are many different ways to measure any given concept. So you think of your operational definition as these tools that you'll be used to measuring the concept. So remember that we talked about tools earlier, not today, but in last week's lecture about different types of tools that you will be using. So these could be a survey, and it's going to be measured by a Likert scale. So that again is your operational definition. So here are a few examples of a concept with their conceptual and operational definitions. So if you're looking at compassion fatigue, well, the conceptual, right, or your dictionary definition is the cost of caring, which includes burnout and secondary traumatic stress. Now, it can be a truly definition as defined in a dictionary. It also can be defined by the researcher, where your operational definition is this PRO-QOL scale or the Pro Quality of Life scale. So remember, your actual tool. If our concept is health, our conceptual definition is absence of disease. Well, maybe the operational definition is number of self-reported URIs per year. Again, the researcher has to define what that is, and then you can read these others. Again, hopefully this, sorry, I keep saying again, this helps quantify and qualify or makes this clearer to understand, putting it this way. So here are some questions for you. So you're going to say, is this conceptual or operational? And the concept is adherence. So that's our adherence. So would you say that the first 1% of ACE inhibitors administered found by taking the number of doses taken divided by the number of doses prescribed? Is this operational or conceptual? Really, that's talking about operational. So they're telling you exactly how it's being measured, all right? Whereas the other one, the degree to which a patient complies with a therapeutic medication regimen, that is a definition of the word adherence. So that is conceptual. All right, let's look at these. So again, operational or conceptual. So our concept is length of stay. Some days, patient is a registered inpatient beginning with the day of admission and concluding with the day of discharge. Again, that is operational, right? Because that is defining exactly how length of stay is measured. Whereas length of time during which a person is a registered inpatient at the hospital, that is the definition of length of stay. So that is conceptual. Hopefully this is making sense and you can see the differences in whether it's operational or conceptual. All right, here's another one. The concept is ambulation. So to walk from place to place or move about. Well, That is a definition, right? So that is conceptual. Whereas, take 10 steps without assistance from a person. That again is saying how ambulation is being measured, so that is operational. All right, another one. Your concept is pain, a negative symptom experience with dimensions of perception, evaluation, and response, operation or conceptual. And then rating on a scale of 0 to 10, where 0 is no pain and 10 is the worst possible pain. That is a clear measurement. We do that, we ask our patients that all the time. So that is operational, whereas the first one is a clear definition. So that is conceptual. So now we're going to move about talking about theoretical framework. So our theoretical framework provides the structure for the study by linking the abstracts to the empirical. So we have talked about theory providing the blueprint or foundation for a research study. This is achieved through a theoretical framework, which can also be called a conceptual framework. These two are used interchangeably, and you'll see them used that way. The framework will identify all the key concepts and how they work together and are related to one another and to the overarching phenomena that is being studied. So it's the structure that links these concepts to the study variables. Now you're going to be asked to identify a theorist and the theoretical framework. You need to be thinking about that framework and how it relates back to your study variables and how it supports your study variables. And you're going to kind of identify, and when you talk about your theoretical framework, you're going to talk about how it supports your variables. So you can do this in a variety of ways. You can do this by graphics. Okay, so this is a pictorial representation of concepts and their interrelationships. So you can see if we were talking about the heart, how all of this functions. A graphic model is empirical and can be easily represented. So if you think about the heart, the eye, lung functions, where if we're thinking about symbolically, a symbolic model is not directly observable and is expressed in language, words, or symbols. If you think about music, it's Einstein's theory of relativity. Many theoretical frameworks are represented by a symbolic model. So you'll see them in articles, especially when you're looking very specifically at the theoretical frameworks, they are represented like this one, the critical caring theory model. Okay, whereas if you're thinking about empirical models, it's generally displayed in some sort of graphic. It's very clear. It says this happens, the flow of the blood goes in this way. So, questions. We're going to test your knowledge. Why is it important to base research in theory? Right? It gives the researcher a logical way to collect data that explains nursing practice. It also allows relationships to be proposed and predictions made. What is a construct? Remember, concepts, constructs. Complex concept where more than one concept are linked together to explain a phenomenon. What is the difference between a conceptual and an operational definition? Remember, we went through all those exercises. Well, a conceptual definition is really your dictionary definition. And your operational specifies how the concept and variable would be measured. So theory used within the nursing profession can be developed by nurses or borrowed from other disciplines, such as through the behavioral sciences, learning theories, or leadership management theories. Nursing theory is described by the degree of abstractness of the theory, which ranges from meta-paradigms, which are very abstract, to practice-level theories about specific information. We will talk about each level on the following slides. So this will take you back probably to your foundations when you talked about nursing theorists and different nursing paradigms. So if you can think of how this is, up here, these are their nursing meta paradigms are very, very abstract. Your grand theories, middle range theories, and your practice level theories are very abstract. So you can see it goes from, again, being very specific to very, very abstract. So the purpose of a meta paradigm is to summarize the intellectual and social missions of the discipline, as well as place boundaries on the subject matter that is contained. Here is the nursing meta paradigm that was coined in the 1970s and showed that there are 4 dominant phenomena within the science of nursing, including person, health, environment, and nursing. Person is the physical, intellectual, biochemical, and psychosocial needs of a human or groups of humans. Health is the ability to function independently, successful adaptation to stressors, achievement of potential, and unity of mind, body, and soul. Environment encompasses external elements that affect the person, and nursing is the science, art, and practice discipline that involves caring. So when we think about a meta paradigm, remember it's this very abstract thinking, but it also is very concrete in its definitions of what is included in that meta paradigm. So there are grand theories, and this really describes the discipline as a whole. So there are all-inclusive that tend to include views of the 4 components of the nursing paradigm that we just talked about, which makes them complex and wide in scope. They are pretty abstract and are sometimes hard to follow due to the philosophical underpinnings. Because of this, nurses have a hard time applying grand theories to research. So think about these. So nursing theories that are considered, again, grand theories. Florence Nightingale's Notes on Nursing, Martha Rajah's Nursing, A Science of Unitary Human Beings, and on down. You will find that you may use some of these in your, or as your theoretical framework and as your theory. You will be able to fit your PICO into one of these. Again, you just have to kind of think outside of the box. Middle range theories are more easily tested and used as framework to base research projects in. They are focused on the real world, what makes them easier to understand. These are probably ones that you're probably maybe more familiar with, because these are utilized in nursing research, and we have a lot of concepts built around this, but they're very limited number of concepts, and they're focused more on reality. Practice level theories are very narrow scope that explains the process of interest related to a specific population. So many names for these sort of theories: practice level, situation specific, my lord, specific or prescriptive theories. They're comprised of a limited number of concepts that are narrow in scope to explain a small aspect of a phenomena and process of interest to nurses. So then we talk about theory is used in research in three ways. So nursing research studies individuals and the interactions they have with their environment to discover interventions that promote optimal functioning and self-care. The goal is to foster maximum wellness. To do this, theory is used in research in three different ways. They can be theory generating, they can be used as a framework, or they can be theory testing. Theory generating examines a phenomenon within a particular context to identify and describe major events. It's considered inductive. It's focused on what and how, but does not attempt to explain why. It is inductive research, meaning that it uses a process where generalizations are developed from specific observations, usually uses qualitative methods. A theoretical framework, when using theory as a conceptual framework to guide research. The researcher will first identify an existing theory and explain the theoretical framework. Then they develop the research question hypothesis that is consistent with the framework. Other items that should be in line with the framework are conceptual definitions for all concepts, data collection instruments, and explanation and support for their findings. And it should discuss implications for nursing to add to knowledge in this difference. We are going to be talking, as you talk about your proposal, you're going to be using a theoretical framework to describe that. So to build a knowledge base that promotes evidence-based practice, research should be developed within a theoretical structure. This structure guides the research, informs the hypothesis, and aids in design, analysis, and interpretation. Theory testing, this process is deductive, which means that hypotheses come from theory and are tested through experimental methods. A researcher chooses a theory to be examined, develops a hypothesis that has measurable variables. A study is then conducted and findings are interpreted using the theory to determine if the theory can be transcribed to practice or if future research is needed. There are real-world examples of all three of these types in your book on pages 81 and 82. Here is a little more explanation of deduction versus induction. Inductive reasoning involves starting specific and then forming a generalized conclusion. In contrast, deductive involves starting with a general premise, which are tested to form a specific conclusion. Deductive reasoning examples. So theory is that all mammals have backbones, which leads to the observations that humans are mammals. So the conclusion is that humans have backbones, right? Well, if you think of inductive reasoning, your observation could be, I tend to catch colds when people around me are sick. So this moves to hypothesis that colds are infectious. We talked in chapter 1 about critiquing research studies and how you have to do a critical appraisal of the study. This is true of the theoretical framework that the study is based on as well. These questions can also be found on page 83. When you're looking at a study, you must follow the theoretical framework throughout the research to make sure it makes sense. The framework should guide the researcher through their hypothesis, methods for measuring variables, and analysis of data. Since we are looking at nursing research, we would also want to make sure that their relevance to nursing is clear. Again, the theory does not have to be created by a nurse. When you are reading studies, sometimes the theoretical framework does not make sense, which is a limitation to the study. For instance, if the researcher is studying pet therapy on test anxiety and they use a theory that has to do with pet theory for children with cancer, this would not be a best fit since the variables are drastically different. Sometimes a study does not notate that what a theory that is, sometimes a study does not notate a theory that it's based on. And I will tell you that sometimes when you're doing this step and we're asking you to identify your theoretical theory in your articles that you find, you may not find one. So now you have a theoretical, or excuse me, oh my lordy, literature review and theoretical framework worksheet that you need to go over and complete. Again, it's for completion. I will look at it and give you any feedback. And then your other assignment is to look for a theorist-specific literature search. So you're going to choose a nursing theorist whose framework is interesting to you, which you have kind of done and thought about. You're going to search the literature using one of the techniques you learned earlier. We did not have a librarian do this, but we talked about this, how you're going to use keywords to do that. You can do that through CINAHL, PubMed, Google Scholar, etc. You're going to find a research article from the last 7 years that uses the theoretical framework you identified in step 1. You're going to write 5 to 6 sentences describing the purpose of the article and how the theoretical framework ties into it. You're going to cite your article using APA format underneath your paragraph. And you're going to tell us about well, you're not going to tell us because we would do this if you were in class, but you're going to complete that and turn that in. All right, here's the game plan for this week and then what we expect for next week. So you're going to turn in all your worksheets. They're due on February 2nd at 23:59. You're going to have your draft PICO question. Again, that's due on February 2nd at 23:59. I'll provide feedback and help you with some revisions on that. You also have an ATI module, Nurses Touch, Nursing Informatics and Technology, due on that same date. Next week, we're going to not have a Chapter 4 mini exam because we don't have those. Please excuse that. I forgot to take that off. And we will have a lecture on informatics and healthcare. And you have as well, next week, we'll talk more about what's due. All right, as always, if you have questions, please reach out, give me feedback, and I hope you have a wonderful week. Thanks.